Good evening, doctors. So I had some many works, so I couldn't engage you with many sessions. So I have come back with a very important topic. So both clinical wise, knowledge wise, and also your examination point of view. Let's start. So today's session is about femoral triangle and adductor canal. So this is Yaseen Sharif, second 𝗵𝗵𝗵𝗂𝒂𝗃 Tagore Medical College and Hospital. Let's start. So before going into the session, I'll tell you what we are going to discuss. Okay, fine. So today's topic is about femoral triangle. So femoral triangle is very important essay question. Okay, so for the university point of view, and then we are going to discuss femoral sheath. That's a very important short note. Then femoral canal. Then very important clinical we are going to discuss. That is femoral hernia. Okay, so if you take in anatomy, there will be two hernias, very important hernias, two types of hernia. There is femoral hernia, and another one is about inguinal hernia. So inguinal hernia you would have been studied in inguinal canal, right? So here we are going to study about femoral hernia. So these two hernias are very important when you go to final year in surgery posting or in surgery class. The examiner like to ask this type of hernia. What do you mean by hernia? So he will definitely ask what is inguinal hernia and femoral hernia. So you have to understand the pukka anatomy of this femoral triangle. Okay, fine. So then we are going to discuss adductor canal. This is very important university short note. This has asked many times, repeatedly asked question. Fine. So femoral triangle is a very important essay question university point of view, and adductor canal is also very important. So then I'm going to discuss two important MCQs for university examination. Okay, then I'm going to discuss a very important PG entrance examination MCQ. So please be with me, spare your time with me for another half an hour. So I'll engage you with many clinicals and very important point of subjects. Let's start, ma. So what do you mean by femoral triangle? Yeah. So what do you mean by femoral triangle? So this is a subfacial. I'll let you know. So what do you mean by femoral triangle means? It's a subfacial triangular space. There is a subfacial triangular space on the front of the upper 1/3 of the thigh below the inguinal ligament. Okay, this is definition, common definition. I'll let you know what you mean by this. So you have abdomen over here. You have an abdomen. Okay, so imagine this as abdomen. So my drawing is very bad. So don't. So imagine this is abdomen. Then from here, the limb start. There is the lower limb starts. Fine. From here, the lower limb starts. So this is abdomen. So whatever in the abdomen, what are the vessels or any lymph nodes, anything. So any vessels that is in the abdomen that has to enter into the lower limb, right? So that will enter into the lower limb through a passage or a depression that is called as femoral triangle. Suppose I have a external iliac artery. I have an external iliac artery in the abdomen that will enter into the lower limb as femoral artery. So through this femoral triangle, that is what I said. So this is a subfacial triangular space. So this is a subfacial triangular space. Why it is called subfacial triangular space means, okay, so it is beneath many fascia. Okay, so if you take the skin, you will take the superficial fascia, and if you take many fascia, you will have this triangular space on the front of the upper 1/3 of the thigh. Okay, so if you, this is the thigh, right? So this is the thigh. Imagine this is thigh. On the front, in the anterior aspect will be, okay, so only in the upper 1/3 of the thigh below the inguinal ligament. Okay, you will have an inguinal ligament. So you have already studied the abdomen part, so you would have been known the inguinal ligament. See, I'll show the diagram, then you will get to understand. So this is the inguinal ligament, this is the inguinal ligament. So till here it will be the abdomen. So it is a subfacial space, many fascia. If you remove all the fascia, you will have this femoral triangle below the inguinal ligament in the anterior aspect on the upper 1/3 only. Okay, on the upper 1/3. This is called the femoral triangle. So in the living people, so normally, so the persons who watching this video, if you want to see your femoral triangle, you can see by by a triangular depression. inferior to the inguinal ligament when the thigh is flexed, abducted and laterally rotated. Okay, what do you mean by like that? See, so when you flex your thigh and abduct your thigh and rotate it laterally, you can see the triangular depression or triangular hollow below the inguinal ligament. Okay, so try it out, man. So below the inguinal ligament, if you just keep if you just, what happened, if you just flexed your thigh, flexed, abducted and laterally rotated, you can able to see the femoral triangle. So clinically, what happens when I study this femoral triangle, sir, if you ask? So femoral triangle is very important to know about femoral hernia. I'll be discussing this very important clinical, I said I'll be discussing. Then another one is psoas abscess, nothing but, so in the floor of this femoral triangle, it contains a muscle called psoas major tendon. So beneath that muscle, if it accumulates any pus, it will lead to psoas abscess. Okay, I'll discuss it on the upcoming slides. Then in this session, so in this triangle, you will have contents. Okay, in that content you will have femoral vessels, so they will palpate those vessels, and in that content itself you will have this lymph node you will have. So if it cause any enlargement of the lymph node, we will call lymphadenopathy. So this all things can be appreciated clinically, so when you study the femoral triangle. So first of all, we'll see the boundaries of this triangle. So what are those boundaries? Okay, so since I said this is a triangle, definitely it will have an apex, it will have apex, it will have a base, and it will have a lateral boundary, and it will have a medial boundary. Okay, fine. What is that? So that is what we are going to see. So base, you have inguinal ligament. So base, you have a inguinal ligament, and okay, so and on the lateral side, what do you have? On the lateral side, you have the sartorius muscle. Okay, no, lateral side you have the sartorius muscle, the medial border of the sartorius muscle, the medial border of the sartorius muscle. And on the lateral side, and on the medial side, you have the adductor longus muscle. But see, medial side, there should be lateral border only. No, why it is medial border? This is very, very important. Why? I'll say why. Because this adductor longus muscle, what happens, it turns. Okay, so you see in this diagram, so the sartorius muscle. Okay, so when you see this one, you will get to understand. Okay, so I'll draw here. So here will be the sartorius muscle. This is a sartorius muscle, and this is the adductor longus muscle, right? So this is what forms the femoral triangle. So this adductor longus muscle, what happens? So on this till here, very sorry, doctors. So this adductor longus muscle, what happens is it turns like this. Okay, so it turns. See, till here the medial. So the medial border is on this side only. Okay, this is the medial border. But when it comes to this triangle, it turns out to be like this. For example, the medial border is here on the upside, on the upper part. So one coming to form. So the medial boundary of the triangle. What happens? The medial. So this muscle, what happens? It flips like this. Okay, if in the mari varo, then what happens? It comes like this. Then what happens? This medial border will come like this. Can you able to understand? Till here the medial border is here. Once it reaches the triangle, the middle border comes this side. Okay, it flips into this side. For that purpose only, we get to have the middle border instead of the lateral border. We can see the boundary has middle border of the adductor longus muscle. Fine. That is what would have been mentioned over here. Okay, and the apex part. Apex is the meeting point of the two boundaries, the middle and lateral. Okay. Right. So what is the floor? So floor is something gutter shape. What do you mean by the gutter shape, ma? So you would have been seen in your roof, the roof of your house. You will have something like this, right? So one stone or roof or floor, a stone or a tiles followed by another tiles. You will have this, right? Box. Same thing will have in this floor. Okay. So the muscle followed by another muscle. See, there will be a muscle followed by another muscle, followed by muscle. This type of arrangement we call as gutter shape. Okay, so we'll see what are those muscles from lateral to medial side. From lateral to medial side, first of all we have iliacus muscle, then we have psoas major tendon, not the muscle, we have the tendon. Okay, muscle is present in the abdominal region. The tendon alone, it forms the floor of the femoral triangle, and is followed by pectineus muscle, and it follows by adductor longus muscle. Fine. See, since so I said, right, I said over here. So in the upper part, it is the medial border is over here only. Okay, but when it comes to form the medial boundary of the triangle, the medial border strips into here, this side. Why it is so? Because the adductor longus itself, it forms the floor, itself forms a part of the floor. So for that purpose, since it forms a part of the floor, what happens? The adductor longus flips into this side. Okay, hope you understand. So what forms the roof? So roof is formed by fascia lata. Okay, there's a fascia. I said, okay, so if you remove all the fascia, skin, superficial fascia, all this deep fascia. There's also one of the deep fascia lata. We'll see this space, right? Femoral triangle. So this is formed by fascia lata. This fascia lata will have an opening called saphenous opening. Will have an opening called saphenous opening. This saphenous opening is very important. Why? Because in this saphenous opening only, this great saphenous vein. Okay, these are contents I'll discuss on the upcoming slide. Just now remember why it has saphenous opening over there. This saphenous opening, through the saphenous opening only, this great saphenous nerve will enter to that opening and will join the femoral vein. So that what happened? The nature has created a saphenous opening in the fascia lata. Okay, so then what and all? So above the roof, so the fascia, the superficial fascia lying. So above the fascia lata, superficial fascia will be there. Okay, so I said, right. So it was one of fascia lata is one of the deep fascia. So above that, what will have? Superficial fascia will be there. So what is the superficial fascia contains? It contains superficial branches of femoral artery. Okay, these all the contents you have to remember, superficial branches of femoral artery. Then it has accompanying veins, upper part of great saphenous vein. Already I said, see, so it will have the great saphenous vein or upper part. Okay, this upper part will be there. Then it will have superficial inguinal lymph node. Okay, so in the triangle you have deep inguinal lymph nodes, but in the superficial fascia you have superficial inguinal lymph node. Then you have femoral branch of genitofemoral nerve. See, this is very important. I'll discuss what it is. I'll draw over here. I don't have okay, I'll draw I'll draw here. Because why I want to explain this femoral branch of genitofemoral nerve, because see, femoral branch of genitofemoral nerve. Okay, this femoral branch you will discuss in the femoral triangle, but same thing, there will be genital branch of genitofemoral nerve. Genital branch of genitofemoral nerve, that will be discussed in the inguinal canal. Okay, so this inguinal canal, which you have been studying in abdomen region, and the femoral triangle are something related to some point of view. Okay, so why? Because there's a common nerve called genitofemoral nerve. Okay, genitofemoral nerve. So this genitofemoral nerve, what happens? It divides into two branches. Okay, it divides into two branches. One is femoral branch. Another one is genital branch. So this genital branch supplies the genital organs. Okay, so then this femoral branch supplies the femoral part. So only one nerve, so the name has come as genitofemoral nerve. So in the since the femoral branch of the genitofemoral nerve, so the femoral branch of genitofemoral nerve supplies the femoral part. We have in the femoral triangle, we have femoral branch of genitofemoral nerve, and the inguinal canal you can see the genital branch of genitofemoral nerve. Okay, fine. So then we will have ilioinguinal nerve branches of this. Ilioinguinal nerve you would have been studying in abdominal region. On the abdomen, you would have been studying about rectus sheath. At that time you can see this ilium down. So only the branches you can find over here, only in the superficial fascia. Okay, fine. So what are the contents of this triangle? So if you see the contents, what are all the contents you have? You have femoral artery. So this is the contents, but it's a pakka anatomy. Okay, so always remember, I always say to all the students, I will always say anatomy is a diagram, diagram is anatomy. That's the only hint you have to understand. Anatomy is diagram, diagram is anatomy. If you don't have any time in your examination, just draw the diagrams, you will get marks. Okay, fine. So that is what. So the diagram, with the help of diagram, you can frame your own words. So I'm going to say with the help of diagram only. See, so the contents, first you will have the femoral artery. This is the femoral artery, I'll say. Then you will have femoral vein. Then you will have femoral nerve. Then femoral artery and branches, femoral vein and its tributaries, and femoral nerve and its branches. Then you will have lateral cutaneous nerve of the thigh. Then you will have deep inguinal lymph nodes. These are the branches of, so these are the contents of the femoral triangle. Okay, what I have said, it will be present over here. Okay, all these things I said. Additionally, you will have this femoral branch of genitofemoral nerve and fibrofatty tissue. See, there is also, it is there in the diagram. This is the mark is marked as F, right? This is what is femoral branch of genitofemoral nerve. Okay, so I already said. Okay, fine. So then we'll discuss about the contents in detail. Okay, so one contents. First of all, I'll start with femoral artery and its branches. What happens? What is the course in this of this artery? So this femoral artery, what happens? It passes from the base of the triangle to the apex. Okay, it crosses the triangle from the base to the apex and directed medially. So medially it will be fine. So since it is medially, so I'll be talking the course related to femoral vein, and while talking the vein, while I'm teaching the vein, I'll be relating to the femoral artery. Okay, so at the base, the femoral at the base, see, this is the base of the triangle. So at the base, the femoral artery is lateral to the femoral vein, and in the apex, it is present anterior to the femoral vein. Can you able to see? It is present because this femoral artery passes medially. Can you able to understand? It passes medially from the apex to the base. It passes medially. So at the base, it is present lateral to the femoral vein. That's what I said is the femoral artery, okay, passes directed down. It is directed downward and medially. Since it's directed downward and medially, so at the base, the femoral vein is lateral side la irukku, and the apex la is anterior la irukku. That's it. Okay, fine. So then what happens? It gives some branches. I'll say you this. I'll let you know the branches. So branches, it has superficial branch and deep branch. I'll show the superficial branch, ma'am. So superficial branch, we have superficial external peduncle artery, then we have superficial epigastric artery, then we have superficial circumflex iliac artery. What do you mean by that? See, only these three superficial branches. See, superficial epigastric artery means it is something related to gastric region, the stomach. So a branch coming from femoral artery is going to supply the stomach, superficial epigastric artery. Then superficial external pudendal artery. Pudendal artery means pudendal itself is related to genital organ. Okay, so the penis, the scrotum, that one. So in male, and the female, those corresponding pons pubis, those and all. So superficial external pudendal artery. The pudendal means related to genital organ. Then superficial circumflex iliac artery. Okay, so fine. Circumflex iliac artery means related to groin, so it will go to the groin. Can you be able to see? It is going to stomach. This is going to the. So this is what is genital organ. That is going to groin. So it's groin. Okay, right, fine. So then what are its deep branches? It has superficial branches only 3. Deep branches enna sir appdin ketomna, we have 2 deep branches. One is, I'll show in this here itself. One deep branch is this one, ma. I'll show it in another color. So one deep branch is deep external peduncle artery. Okay, so one deep branch is like, sorry. So the deep branch is the deep external peduncle artery. This one. Okay. So deep. So because see, deep branch, superficial branch is superficial external peduncle artery. Deep branch is deep external peduncle artery. Simple. This one deep branch. So superficial branch, so femoral artery gives 3 superficial branches and 2 deep branches. So what is the one more deep branch? One more deep branch is profunda femoris artery. Sorry, profunda femoris artery. So this one is called the profunda femoral artery. So you can able to see this one. This one is called as profunda femoris artery. So this profunda femoris artery, it arises from the femoral artery some 3.5 cm below the inguinal ligament. This 3.5 cm below the inguinal ligament, it arises from the femoral artery, and it divides into 2 branches. One is medial cutaneous, one is medial circumflex. This one. So this one is, I will be saying this one has medial circumflex femoral artery, and this one has lateral circumflex femoral artery. Okay, this is lateral circumflex femoral artery, and this is medial. Sorry, it has not written in the diagram, but this one is medial circumflex femoral artery. Medial circumflex femoral artery. Okay, so what happens? This medial femoral artery, once after arising from the profunda femoris artery, what happens? It spirals behind the femoral vessels. Can you able to understand? Behind the femoral vessels, and it passes between the psoas major tendon and pectineus and disappears. But this lateral circumfemoral artery, it passes between the anterior and posterior division of the femoral nerve. This is the femoral nerve. This anterior division is the posterior division. It passes between it. Fine, right? So then what happens to the femoral vein? I'll say, sorry, I didn't say about the femoral okay, fine. Femoral vein now. So femoral vein is very simple. Same thing I said. Femoral artery, I'll say the course related to femoral vein. Femoral vein, what happens? I'll say the course related to femoral artery. Simple. So what happens femoral artery at the base? What happens what happens to femoral vein at the base? It is medial to femoral artery, and on the apex it is posterior to the femoral artery. Simple. So I won't say this always for an artery only they will have branches. For vein it will have only tributaries. Okay, you know, right? So it will have only tributaries. So what are its tributaries? Okay, so it has. So what are all the superficial branches of femoral artery? Same superficial branches of femoral vein will be there. For example, I said here, right, superficial epigastric artery. So it will have superficial epigastric vein, femoral vein. Superficial external peduncle artery. So likewise, you will have superficial external peduncle vein, and superficial circumflex iliac artery. You will have superficial circumflex superficial circumflex iliac vein. So then, apart from the superficial branches, you will have 2 deep branch also. Okay, so then you have 2 extra branches, not deep branch. You have 2 extra branch. One is not branches. Very sorry. So 2 tributaries. One is great saphenous vein, and another one is profunda femoris vein. In the artery we had profunda femoris artery, right? So here we will have profunda femoris vein. That's it, man. So femoral nerve. Now we are going to discuss about the femoral nerve. So how it will be. So femoral nerve, very very important. Femoral nerve, because why? Femoral nerve, it is lateral to the femoral artery and femoral vein. Okay, it's lateral to femoral artery, and this is what I want to mention. The starting of the session, I said, right, I'm going to discuss 2 important university MCQs. That is what is. So these 3 things, that is femoral nerve, femoral artery, femoral vein. Okay, so these things and all. See, the femoral artery and femoral vein will be enclosed in a separate sheath called femoral sheath. I will discuss in the upcoming slides. Okay, so but only the femoral nerve won't be in the femoral sheath. It will be lateral to the femoral sheath. It will be outside the femoral sheath. This is one very important MCQ. In the university examination, one MCQ will be like this. So which content of the femoral triangle will be outside the femoral sheath? That is femoral vein. Okay, so inside the femoral sheath you will have only femoral artery and femoral vein. You won't have femoral nerve. Fine. So what happens? So the femoral nerve, what happens? It divides into anterior division and posterior division, some 2.5 cm below the inguinal ligament. So this anterior division is again divided into 2 branches. One is, what do I say? Means 2 cutaneous branches. Okay, so these all are going to supply the skin. Okay, Two cutaneous branches. One is intermediate. This one is intermediate cutaneous nerve of the thigh, and this one is called as medial cutaneous nerve of the thigh. Okay, this one is intermediate and this one is medial cutaneous nerve of the thigh. So this medial cutaneous nerve of the thigh, what happens? It is something is just related to the femoral artery. That's it. And okay, and the saphenous, then the posterior division, it has only one. It give rise to only one branch. That is saphenous. This is known as saphenous nerve. Okay, the posterior division of the femoral nerve give rise to only one branch. That is saphenous nerve. Fine. That is present later to the femoral artery and is going to cross the is going to cross femoral artery anteriorly at the apex. Can you able to see this? That's it. So then one more content, that is lateral cutaneous nerve of the thigh. Lateral cutaneous nerve of the thigh. So this is very important. Okay, so just listen to this lateral cutaneous nerve of the thigh. With regarding to this, there is very important PG entrance examination MCQ. I'm going to deal with this right now. Okay, what happens is lateral cutaneous nerve of thigh. It is going to enter the. It is a branch of lumbar plexus. Okay, it is not this. See, this is medial cutaneous nerve of thigh. This is intermediate cutaneous nerve of thigh. These two branches arises from the anterior division of femoral nerve. But the lateral cutaneous nerve of thigh, it is not arises from the femoral. You should not confuse. These may also ask in university examination. Why MCQ? Medial and intermediate arises from the anterior division of femoral nerve, but the lateral cutaneous nerve arises from the lumbar plexus. Okay, once is how it enters the femoral triangle. It enters the femoral triangle behind the inguinal ligament, behind and lateral end of the inguinal ligament. Okay, so this is what lateral cutaneous nerve just enters the triangle. Okay, so behind the inguinal ligament and supplies the upper part of the lateral end, upper lateral part of the thigh. Okay, upper lateral part of the thigh. So what is the important PG entrance examination question means? Okay, so the question will be like this. So before going to question, I'll say the clinical behind it. The clinical is question. Always in PG entrance examination question and all, they will ask clinical oriented. Okay. So sometimes what happens while entering the femoral triangle, since it passes this lateral cutaneous nerve enters, it enters behind the inguinal ligament only, no. So what happens? Sometimes it is compressed behind the inguinal ligament. Okay, so it compressed behind the inguinal ligament, and it will produce some pain, pain and some pricking pain also. Okay, that condition we called it as 𝗵𝗔𝗂 𝗵𝗂𝗂𝗂. Okay, 𝗵𝗔𝗂 𝗵𝗂𝗂𝗂. Nothing but the compression of the lateral cutaneous nerve of the thigh behind the inguinal ligament. Okay, so just behind the inguinal ligament. So it will have some tinkling like sensation, like poking. Okay, pain இருக்கும், ரொம்ப பெயினாக இருக்கும், குத்துற மாதிரி ஒரு சென்சேஷன் இருக்கும். ஸோ ஹவு த சர்ஜன் வில் ரியலி, ஓகே, ஸோ இந்த பேஷண்ட் வில் கம் டு த டாக்டர் இந்த மாதிரி எனக்கு பெயின் இருக்கும் டாக்டர்னா, ஹவு த டாக்டர் ரியலி மீன்ஸ் ஜஸ்ட் நத்திங். வாட் ஹேப்பன்ஸ், he will cut some of the fibers of the lateral end of the inguinal ligament and it will relieve the lateral cutaneous nerve. This is what the PG entrance question examination question mark. Okay, he will ask lateral cutaneous nerve of the thigh. Okay, lateral cutaneous of the thigh being compressed behind the inguinal ligament. What is the condition known as? That is called as 𝗵𝗔𝗂 𝗵𝗂𝗂𝗂. Please do understand, very important. This has asked in 2012, I think 2012 PG entrance examination. Okay, so please do understand. Fine. Then now we'll study. Then another content is about deep inguinal lymph node. Already I said superficial inguinal lymph node is present in the superficial fascia. That is not related to femoral triangle. We are going to see deep inguinal lymph node. Deep inguinal lymph node, we have 3 in number. Totally we have 3. I'll show you over here. I think it's not there. Okay, so it's not there. I'll say deep inguinal lymph node is 3 in number. Okay, so first one, so the lowest one will be present below the junction of great saphenous vein and femoral vein. So this is the lowest one, and the lowest one, okay, the intermediate one will be present in the femoral canal, and the highest one will be present in the femoral ring. So what do you mean by femoral canal or femoral ring? I'll discuss in the upcoming slides. Till now you please understand. Okay, this is the lowest one. one sec. This is the lowest one, this is the intermediate one, and you will have what this here will be. Okay, konjam idu mela irukum. This is, I will say it as highest two. So totally there will be three there will be three lymph nodes. Fine. Okay, so now we are